For more anatomy videos, please subscribe to my channel Learn Anatomy with Dr. Tanya Hashik. In this video, we will discuss the anatomy of ureter. Ureter, it is a pair of narrow, thick-walled muscular tube which carries urine from kidney to the urinary bladder. The upper part of the ureter, it lies in the posterior abdominal wall, whereas the lower part of the ureter, it lies in the lateral pelvic wall. Now we will look into the dimension of ureter. Each ureter, it is about 25 cm long, and the tube, it has a diameter of 3 mm. But it has slight constrictions at 5 places, that is, the tube is slightly narrowed at 5 places. We will discuss about it. First constriction, it is at the junction between the pelvis and the ureter, that is called as a pelvic-ureteric junction. Next constriction, it is seen at the pelvic brim, that is brim of the lesser pelvis. Next constrictor is seen at the point where the ureter is crossed by the broad ligament of the uterus. Next constrictor is seen when it crosses the bladder wall. And the last constrictor is seen at the opening of the ureter into the bladder. Now we will look into the relations of ureter. Just outside the kidney, the right ureter, it is related to the second part of the duodenum, the renal vessels, that is renal artery, and also to the renal vein. And the left kidney, it is related to the left renal artery and also to the left renal vein, and it is also related to the pancreas and also peritoneum. You cannot see the pancreas and peritoneum in this figure. So now we will look into the posterior relations of the upper part of the ureter. The left and right ureter, it is related to the psoas major muscle. Now we will look into the anterior relations of the abdominal part of the left and right ureter. So first is the right ureter. It is related to the third part of the duodenum, right colic vessels, to the ileocolic vessels, to the right gonadal vessels, and also to the root of mesentery. And the left ureter, it is related anteriorly to the left colic vessels, to the sigmoid vessels, to the left gonadal vessels, and also to the sigmoid mesocolon. Now we will look into the posterior relations of the ureter. Posteriorly, the abdominal part of ureter, it lies on the transverse process, and it is also related to the psoas major muscle and also to the genitofemoral nerve.